So someone needs help with this procedure that they were given. This came out, and what I'm assuming is when I was reading this earlier is that, this is a list of what they did. And a lot of times in these reports, you'll see them listed, 1, 2, 3, 4, so they did a left heart catheterization, left and right selective coronary angiography, right, oh dear, how do you say that, Laureen?
Iliofemoral?
Yep, iliofemoral angiography, management of conscious sedation, abdominal aortography with visualization of both renal arteries. Now, it looks like there's tons of stuff going on here. And if you were to look at that, I'm sure you're kind of thinking, oh my word, where do I start? So what we're going to do, we're going to start with a left heart cath. 93458. Oh, this is what she did. This is actually what she was thinking. She was going to use 93458 with a modifier 26. Oop, went too far.
Sorry.
You're sliding up. Oh, there we go. No, go up a little bit more. Oh, there it is. But she was confused. I read the CPT book several times. I went online to find the answer, and I had no luck. I'm confused. Does this code include everything that was done, or am I missing other codes that this procedure was done? So she says, please help, and I think her name is Magda. Well, this is common. You don't think that you're the only one out there that has problems with this. And she did everything right. She went to the CPT book, she looked at it, she went online, she did her other resources, and she still isn't positive. And that's, I think, something that coders have to remember. They're really researchers, actually. And I've had several people say, well, do we get to use our book? Yes, you get to use your book for everything, because that's what a coder does. So this is the report that the doctor gave her, which is actually a duplicate of what was above. Scroll down just a little bit, Laureen. I can hear Laureen typing and answering questions.
Oh, sorry.
So that's all right. No, I think it's funny. It makes it sound very smart. So I'm not going to repeat that. The thing here, complication, none. Okay, there was no complication. So we get to move aside from that. Don't think of that. Estimated blood loss, 20 mil local approach for the right femoral artery. Scroll down just a little bit more, Laureen. And blah, blah, blah. Most of this stuff, keep going. Okay, I'm not going to read all of that because we're going to go over it, and you guys can access this again later. But this is all the description of what she was reading to come up with her codes. Go ahead and keep going down a little bit more. We had an ejection fraction. That's important. There's our conclusion. Scroll down just a little bit. Okay, now here we go. Here's the meat of what you need to know. It's actually so much simpler. When you look at that and say this was a board exam question, I mean, this would throw you for a loop, but in the answer, you're going to break down 93458. Scroll down just a little bit, Laureen. Number 2, catheter placement in the coronary artery for coronary, and notice it says S, for coronary angiography, including the intraprocedural injection. Now, right there, see? That's included. For coronary angiography, imaging, supervision, and interpretation. That's all included. So, with left catheterization, including the intraprocedural injection for left ventriculography when performed. So yes, it includes the 3 main pieces to the cardiac cath: the catheter placement in the coronary vessel, the catheter placement in the heart, and the dye injection and the pictures or the imagings that were taken. Now, let's see. So anyway, if you wanted to go into more detail or anything, you'd have to see the rest of the op report, I guess. But that's what they'll also do, mind you guys, if you're taking a board exam. They're going to want to know, can you determine if all of those questions or everything that was done to that patient, are you going to need one code or are you going to need multiple codes? And see, if you go in and you look at that and you break down that op report and then you break down what the description of that code was, everything was there. And you can do that with a highlighter as well if you're not at work, but you can use a piece of paper and to make sure. So that really is an excellent question. I'm glad you asked that, Magda.
Get more CPC exam tips, coding certification training, and CEU credits. go to www.codingcertification.org.